Hi, I'm Dr. Mirrafati from Mira Aesthetic. We are covering basically the sixth reason why people change their implant after 10 years. So number two cause of implant changing is implant deflation. Now, there are two types of implant, saline and silicone. Also, I might say before we get to implant deflation, implant rupture or implant deflation more happens when you're under the muscle, by the way. If you're athletic or if you have strong muscle, you can imagine when you're under this pectoralis major muscle, which is the muscle of your chest, and you're putting an implant in here. Every time you lift something, every time you pick up something, every time you open a door, or you go work out, or you do push-up, whatever it is that you do, this muscle contracts and is squeezing that implant. So deflation not only is not just say only happens under the muscle, but more often happens under the muscle, specifically on the patients who work out. So when I do my implant under the muscle, which is about 50-60% of my time, I go under, or for 30%, I go over. If you have enough breast tissue, I certainly go over because I don't want to rupture or disrupt any part of that muscle. But anyhow, that I covered that in another video. You can go in detail about the placement of the implant. But implant rupture happens most of the time when you're under the muscle. Now, two types of implants, saline and silicone. Saline obviously is noticeable. It's salt water. It has a valve there. So like anything, it's human error. Now that doesn't mean it's specifically after 10 years it happens. That does not mean that at all. It's just matter the longer you have it in you, which is 10 to 15 years. That's the marks. If you go, sometimes people have deflation. Sometimes you don't have deflation at all, implant deflation at all, because I had been doing this for over 30 years, 8,000 augmentation, and certainly I haven't seen that many deflation. But that's number two reason why breast implant revision, because of deflation. So with saline, you immediately see it. Sometimes there's a partial deflation, which means maybe that muscle just squeezed that implant out and that valve opened up, boom, squirted up the fluid, went out, it deflated. Now it just looks smaller than this, what we call a partial deflation. And sometimes it's a full deflation over maybe a period of a week. You see gradually things going down. Now, statistically, I have seen more partial deflations and full deflation, but they can both happen. With silicone, however, you don't lose it. I mean, silicone, especially with newer silicone, the older silicone, yes, it went all over, you felt it, it's just basically got mushy. But with the newer silicone, which is basically the MemoryGel or the Gummy bear implant, right? It just basically means that even if there is a rupture of the implant, the silicone stays inside, so it's not dissipated all over. It's not like you have to run to a doctor to change it. However, it's a very good idea once you determine through MRI. By the way, so that's how you can detect it. When you do MRI or mammogram, you find out that, hey, there's a possible rupture. Obviously, if it shows in the mammogram, you want to make sure with MRI that it is ruptured. Then start looking for a doctor that you trust and you want to go do, and then you do it. So I actually did, in one of my prior videos, cut an implant. So this is a MemoryGel implant, right? Made by Mentor. And I literally made a cut, and I don't know if you guys can see this, right in the middle of it. I put a blade and I literally cut this implant. Now, you can see I'm squeezing the implant and holding it upside down. Nothing comes through. This is what's called MemoryGel implant, because it has a memory to stay within the shell, and then when the pressure is taken off, as you can see, it goes back, right? So its pressure is on, or even if I'm no pressure, it stays within the sac. It doesn't go all over the place. And when you go back, if no pressure, it basically sort of the gap closes. I mean, it doesn't close. It's still, the shell is broken. As you can see, I cut this with a blade. So this is the beauty of the MemoryGel or the Gummy bear. They both work in the same, context. Is just when you're holding the implant, you can see the silicone doesn't run all over your body. So that's why it's not an emergency for you to run into the doctor and change it. But, it's ruptured. So every time somebody's or you're squeezing your breast, that thing comes out and in essence can irritate the capsule that's around that implant, and you might lead to a capsular contraction while you have a ruptured implant, and then leads into a capsular contraction. So if through mammogram that you should do when you have an implant, by the way, you should do periodic mammogram depending on your family history of breast cancer. Any girls should do a mammogram, obviously. And if there's a suspicious of a rupture, then especially if we have silicone, obviously with saline, you will see it. When there's a suspicion of a rupture, then obviously do MRI to make sure it is, and start looking for a doctor that can change that implant. The cost-wise is about $10,000 to $11,000, depending on doing saline or silicone. It's pretty much the same cost as capsular contraction. It's just a revision of the surgery. Now, if you have the old Dow Corning implant where implants all over the place, I charge a little bit more because now you have silicone cleanup all over the places that you have to go clean up. But if you do have the rupture, it's a good idea to clean it, to actually change it, because every time that silicone comes out and touches the tissue, that sort of creates a lot of irritation in the capsule, and that might lead to a calcification, which makes your surgery a little bit longer and the recovery a little bit longer as well. So once you find out that you have a rupture, basically it's a great idea to change it. Now, if you guys find out these videos are educational, you like it, go ahead and hit that subscribe button, or write to me if you want me to in detail go over any of these videos that I do. Stay healthy.